I started Invisalign, and there's something I definitely didn't expect. I'm Dr. Scheurer, and I'm here at my office, Tranquil Dental. I started Invisalign because I realized that my lower front teeth were actually kind of growing up out of the gum line. So I realized this because I was grinding my teeth, my lower front teeth, and actually starting to wear and chip them a little bit and needing to have some fillings placed. And so when I started to really kind of evaluate them and look at old models that I had, I could see that my lower front teeth were moving. I bet that happens to a lot of you. When you're biting on your back teeth, you really want your force to be placed on your back teeth and not on your front teeth. But my lower front teeth had kind of scooted up. So I decided that I needed to start Invisalign. The process to start was really super easy. I already had my x-rays here. I just needed to have a scan completed and to have some photographs taken and get all of the aligners fabricated. They were shipped here to the office, and I had some attachments placed on my teeth. So they're like little bumps of filling material that help the aligners to grab on to create certain forces that we need. And then I started the process. So the one thing that I didn't expect was how quickly the process would actually seem to go. I'm shocked. I just finished my 10th aligner out of 20, and I feel like the process has gone so quickly. I took a scan so we could actually see the difference that's occurred in just those 10 aligners. So I wanted to show you that difference and how we can see that difference on the iTero scanner. So let me show you this scan here, and I'll give you a little bit of background too. So what you'll see in this scan is the actual literal comparison of my scan before I started Invisalign and then my scan from just today. And so when you, well, actually it wasn't today, it was last week. I was a little excited, I wanted to know. So what you see is an overlay of the two different scans, and where you see difference, where you see change is where you'll see kind of like a weather map. So anywhere from yellow to orange to red or darker red there. Obviously, you can see that there are some really large, let me see, just a little bit. There we go. You can see some really large red dots there. And those are those bumps that I talked about of filling material, which is actually the same exact color as your teeth. And so you really don't notice them. But on the scan, you can see those bumps. And so that's a big change from before I started to the present day. If you look at this square right here, this is actually this circle here. So it's showing you my canine and my two front teeth, and that one is worn, my two front teeth on the bottom to the right-hand side. And so this was back from a scan back in July, which was actually before I started. I thought that I had hit the other scan, but it'll show you the same exact thing. So this is from July, and so what you can see is the position of the teeth right here, and then this is from March 8th. And so I'm going to hit this play button, and what you'll see is it'll jump back and forth between these two dates, and you can see the difference, the change. So you'll have to ignore the attachment like we talked about before, but you'll actually see these teeth move down. So pretty neat stuff. So this is before, and that's after. Before, after, before, after, after. So here you can see the attachment, and here you can see how they've scooted down. Or if I move it over like so, let's look at the other side here. I'm going to stop it. So this is the before again. And so you can see my canine. You can actually see this tooth is up higher than the edge of that canine there. And then this one next door, unfortunately, was worn from when it had grown up out of the gum line. But we're going to get them right back into position where they need to be so they don't do that anymore. So here I'm going to hit the play button. So that's before and that's after. Before and after. Before and after. So you can see how it moves down. Both of those teeth are moving down. And there's the attachment there. So I was just really surprised at how quickly the process has gone. I'm halfway through the Invisalign journey, and I can see that movement. I can see it myself visually, but I can see it there on the scan too. It's just right in front of your eyes. It's really amazing to be able to see that difference that can occur over such a short period of time. That's the part I didn't expect.